Welcome to today's lesson on cardiovascular history taking. Our focus will be on three main common important symptoms, that is chest pain, palpitation, and dyspnea. So by the end of this session, you will know how to structure your questions to get accurate and useful clinical information. So these objectives will guide our session. We'll look at each symptoms individually, learn the relevant history taking questions, and also discuss how to recognize urgent presentation. So by the end of this lesson, you're supposed to know how to identify questions for chest pain history. You're also supposed to know how to explore symptom details for palpitation, assessing dyspnea history effectively, and also recognize the red flag symptoms that requires urgent attention. So a good cardiovascular history starts with broad and narrows down. For chest pain, the Socrates is supposed to use the Socrates mnemonic, which is very much useful. So you're supposed to always explore associated symptoms like dizziness, syncope, or swelling, and don't forget to check the cardiovascular risk factor. So you're supposed to start with open-ended question. Socrates is the must method for pain. So we're supposed also to be clarity on onset, duration, and progression. So also ask about the associated symptoms and also explore the risk factors and past medical history. On this part, when assessing chest pain, think about the classical features of angina or myocardial infarction. Also, pain radiating to the jaw or left arm or associated with sweating and breathlessness should immediately raise the concerns. So if you're using this Socrates, for S is site, where is the pain? Supposed to know where the pain is. O is the onset, sudden or gradual. C for Socrates character. Is it crushing, stabbing, or burning? R is for radiation to the jaw, arm, or back, because this is specifically for chest pain that involves the cardiovascular. So you're also supposed to note the associated symptoms. Is the patient sweating? Is there nausea or breathlessness? And the T on the Socrates is time. Constant or intermittent? Is it a constant pain? Is it an intermittent pain? And the E is an exacerbating factor or relieving factor. Is the pain exacerbated by exercise, or is it exacerbated by rest, or is it relieved by medication? And the last is the severity. So this is where you scale the pain from 1 to 10. Now let's shift our focus to palpitation key questions. So palpitation can range from harmless to life-threatening arrhythmias. Your question should help determine the pattern, triggers, and associating symptoms. So you're supposed to know how a palpitation description. Is it fluttering, pounding, skipping beats? You're also supposed to note the onset and the duration. When did it start? How long does it last? You're not supposed to forget the triggers. Is it exercise, caffeine, stress, or alcohol? So on the same palpitation also, the key question is supposed to ask with the associated symptoms. Is there dizziness? Is the palpitation coming with chest pain? Is the palpitation coming with the shortness of breath or syncope? And the other thing that you're supposed to note as well is the frequency. How often do episodes occur? And the last part is supposed to pay much attention to the past history. This is where you ask about if the patient has any thyroid disease or any heart condition. So these will give you a clue on how to set or ask question on palpitation during cardiovascular examination. When dealing with dyspnea assessment is the key to identifying heart failure, pulmonary disease, or anemia. Ask about orthopnea or paroxysmal nocturnal dyspnea. This points strongly toward the heart failure. So these are the questions that you're supposed to pay much attention to when you are assessing dyspnea. The onset, is it gradual or sudden? Duration, accurate or chronic? Progression, this is where is it worsening or it's stable? You're also supposed to consider the triggering factors. Exercise, you can ask the patient, does exercise trigger the dyspnea? Does lying flat triggers the dyspnea? Does nighttime triggers the dyspnea? Because in the dyspnea part, this is where you can identify if the patient might have or have heart failure. Also supposed to note the relieving. Does the patient feel relieved when sitting up? Or does the patient feel relieved when taking medication? You also consider the associated symptoms. Does the dyspnea associate with cough, wheezing, or chest pain or swelling? And also the other thing that you're supposed to pay much attention is the functional impact. How far can you walk before stopping? So these are the dyspnea questions that you're supposed to tell yourself when you are having an OSCE exam. These are the questions that you're supposed to ask. Onset, duration, progress, trigger, relieving, certain factors, as well as the functional impact. Now let's talk about the red flags. So always watch for red flags. This requires urgent referral or emergency intervention. Urgency referral or emergency intervention. So the red flags include severe crushing chest pain, syncope with palpitation, sudden severe shortness of breath, new neurological deficit with the cardiovascular symptoms, as well as the hypotension with the symptoms. So these are the red flags. So in summary, structured cardiovascular history taking helps identify serious condition early, stay systematic, stay alert for red flags, and always consider the patient's overall clinical picture. So thank you very much for paying much attention. This was just a quick part of the cardiovascular examination during OSCE. So we had considered much on the chest pain, palpitation, as well as the dyspnea. So when it comes to chest examination, cardiovascular examination, it's a broad topic. When you're doing a full cardiovascular examination, you're supposed to pay much attention with those things. It's a broad topic. This has been Brian Mouse, the clinical tutor for OSCE Academy. Have a blessed day.